surface. Okay? During the years, this other company proved that the rough metal surface is better. So when it's complete, the idea, Branemark changed this implant. So there is no date. It's becoming with years.
Change according to the
Yes. Yeah. Theories. Okay? Let's go. Let's talk about the most important thing in implantology. Okay? Without the titanium oxide, okay, we cannot have a integration. When we have titanium oxide, ever.
I'm asking about this titanium resistance. Does it depend on the material used or it depends on individual? And what are the sizes of titanium?
Sure, sorry. You remember me. I said normally we use titanium grade 2 and titanium grade 4, yeah? And number 5. Number 5, it's not considered anymore a pure titanium. You can consider it as an alloy. Okay? Why an alloy? Because we have, just a minute. Oh, this beautiful mantle. We have 90% of titanium. Okay? 6% of aluminum. Okay? And 4% of vanadium. Do you know vanadium? Yeah. So it's not a pure titanium anymore. It's an alloy. It can be considered an alloy. When we use this type of titanium in orthodontics anchorage. Why orthodontics anchorage? Let's understand. First, successful of titanium grade 5. We are telling about 97 to 98% of successful. Yeah? Titanium grade 2 and titanium grade 4. Good. When we think in titanium grade 5, we can have 50 to 60% of successful of osseointegration. Few. Yeah? Less osseointegration. But why we use it as an orthodontic anchorage implant? Because orthodontic anchorage implant is a temporary implant. You use it, okay? You place it in position, and in the end of the treatment, you take it off. Okay? You understand? You take it off. You don't need the effective osseointegration. Okay? You just need to feel to have some few resistance for the teeth movement. Okay? Did you understand? Which power? .3 to 0.4 grams. Fuel power. Yeah? Okay? That's it. In this type of implants, we use titanium grade 5. And why an alloy? Because we have more resistance. Okay? Because this orthodontic anchorage implant is a small one. Very small. Okay? We need more resistance. Did you understand the idea? Okay? But if we have osseointegration around these implants, no problem. You can take it off with a drill, okay? Or you can cut the neck and leave it there. It's osseointegrated. What we do when we leave an implant inside the bone? It's the same thing. Yeah? You can leave it there or take it off. It depends on the case. Okay? Good? That's it. That's the titanium grade 5 implant. Sure. Let's go. Titanium oxide. When we have titanium oxide? Ever. Why we have ever this type of titanium oxide? Okay? If I look at this metal, during the years, what happened with this? Rust. What is the crust? The oxidation. Yeah? All the metal in the world have an oxidation. Okay? What will depend if we have a crust or we not have a crust? Let's see if we can see the oxidation or if we cannot see the oxidation. Type of the metal, temperature, and pressure. Okay? So, titanium will have rust ever. Okay. Let's understand this rust. Basically, what happens when you have rust? Normally, the metal tries to equalize with the environment. Okay? Environment? Yeah? Yes? The metal always tries to equalize with the environment. How? With a layer of oxygen. That's why when we have a beach area, you have more crusts, okay? Then, if we are in the mountain, why? Because we have more humidity. Yeah? Sure. Okay. When these ox form, first, with air contact. Okay? Second, with water contact or humidity contact. Okay? Very good. I told you that the oxide is when the metal tries to equalize with the environment. Very good. If I pick an implant here right now, I have a dox? Yeah. If I place it inside the water, I have dox? Yeah. If I pick the implant in my hand right now, I have dox? Yeah. If I place this implant inside the bone with blood, I have a helix. That's the first step of the osseointegration. Why? Because the metal tries to equalize the local. So he will try to equalize with the blood. Okay? The first step of the disintegration. Very good. Titanium is inert. And the oxide is bioactive. Sure? Very good. Why bioactive? Because when we cut with the blood. Very, very, very good. Why is bioactive when we have this contact? Because when you have the contact not with the blood, the plasma of the blood. Okay? The plasma of the blood is the most important thing in this first stage of the oxidation. What happens when you have contact with this plasma? Okay, this oxygen layer and the plasma activate, okay, some types of proteins, attract some types of proteins. Okay, these type of proteins will attract some mesenchymal cells. In different mesenchymal cells. Yeah. These mesenchymal cells will change by osteoblasts. Okay. After that, it will start to produce what? Bone. That's it. Okay? That's the basic idea. Okay? It's a little bit more difficult, okay? But just the basic for you to understand what happens when this implant begins his contact with the blood. So, an implant with affinity to water is better or not? Yeah. I'm going to do another question. If I have a wall, a totally flat wall, okay, and I throw some water, what will happen with the water? All out. And the wall will be dry. Wait, sorry, what? Dry is the will be wet. No. Wet is when you have water, yeah? Yes. No, you will not have water. Because the water will... Wait. Okay. If I have a rough surface, like this, with some few holes, okay? When I throw water, the water will fall. But in these small holes, I will have water. So, a rough surface is better or not than this? Yes. That's it. That's why the technology changed to rough surface. Okay? Another important thing, we know that a fibrin network, yes, fibrin network. Let's use this one here. I have a fibrin network. Okay? It forms a fibrin network. Very good. Like this. Okay? Very good. After this network be used for the coagulum? Yeah. What is the other function of this fibrin network? What is this? Stem. Osteoblasts use this fibrin network as a stem. Okay? Did you understand? It uses a cell, this fibrin network as a stem. Very good. Let's think again. If I have a flat wall and say to a man, a climber, yeah, to climb this wall, he can? No. If I have a rough-net wall, he can? Yes. That's happened the same thing with the fibrin network. Because it's a one, it's difficult for the fibrin, okay, to have the adhesion to the wall. If we have a rough-net surface, it's easier for the fibrin to adapt, to fix. Okay? Understand that? Very good. So, what happened when we have the machined surface, the flat one? Some fibrins will stay like this. Not like this, will stay like this. Like this. Okay? And when the cell uses it to go up to go until the metal, it will be like this. And you will not have an effective arriving of the cell. Okay? Did you understand? So that's why when we see in microscope, okay, this machined surface, this flat surface, we can see points of separation. You understand? That's it. When we have rough surface, we have no points of oscillation. We have oscillation. Okay? Very good. Did you understand this? It's a little bit difficult to understand, but I try to explain to you, basically for you to understand what happens when you place an implant in position. It's not only to place in position. We have to know what happens. Okay? Did a break or not? Just a minute. Okay, just pause, please. We have many things to say.
For some bars.